This is Patty, nurse practitioner at,
West Broward Internal Medicine Practice.
you see the red button means that we're filming.
Okay, the red means what?
That is filming.
Okay, so it's filming. This is West Broward Internal Medicine. Today is June the 3rd. We're very delighted to have Broward College students with us today. We have our students here diligently preparing.
This is from the CDC, the latest recommendations. Okay, so that's one is for the shot, and the other one is the differences between the shot and the nasal.
Give the nasal
Yeah. It's gonna be a little bit of a review. This is for you, Patty, and we can leave this here for the rest of the people to have. It's good information. It's from the CDC, so it's nothing that we made up.
Okay, right, exactly.
Okay, so we can start?
1, 2. Right.
Event is coming,
Okay.
so you have full crown.
Perfect, all right, yay.
I'm sure that all of this information you guys already know, so this is kind of like a review, like the latest things about it. We're gonna make sure about some questions that some people have, and that's why they don't take the vaccine. Good. So we're gonna go over.
Yvonne, Brittany.
Yes, and we're doing the RN to BSN program at Broward College, and this is one of the community assessments that we have to do assignments, which is to teach the community. And thanks to Patty, we're here providing this education to you guys. So we appreciate you guys having us here. Okay, and she's gonna start, Dean.
So I'm going to tell you a little bit about the flu. Seasonal flu, it usually begins between October to about May. So it's a contagious respiratory virus. Kind of nervous. So it can be mild to severe. It can also lead to death. Usually you have to tell patients in relation to the flu that it's important to take the vaccine in order to prevent symptoms. Actually minimize the symptoms. It doesn't always not get any symptoms per se. There are 2 types of vaccines. They have the nasal vaccine and the shot. Most patients don't like the nasal vaccine because they feel like it's probably going to burn or it's going to sting the nasal passages. But actually, not everyone gets that symptom. It's actually easier to get the nasal than the vaccine. Because not everyone likes to get a shot. Also, there's 3 types of flu vaccines. 3 types of flu. The H1N1, the H3N2, and influenza E virus. And usually it's a combination vaccine that's given each season. Before the new vaccines that come out for every year, they have to find out which one is more prevalent so they can make sure that patients are vaccinated with that. Key symptoms sometimes is usually, it feels like cold symptoms, but in order to determine if it's the flu, we have to do an actual test to make sure that it's the flu vaccine, virus itself.
Okay, so now I'm gonna go over a little bit of the misconceptions about the flu vaccinations. So I'm gonna give you questions that normally people ask, and then I'm gonna give you the answer. One of the questions is, can the flu shot give me the flu? And the answer is no, it won't give you the flu. The flu vaccines, like she explained, there are 2 vaccines, one with the live vaccine and one with the attenuated or weakened vaccine, meaning that it doesn't have, it's a little bit of it, but it's attenuated, that is not going to actually provide you or give you the flu. So the attenuated one, which is the nasal one, because they don't give the live vaccine per injection, it's just the nasal one. It's recommended for children 2 years to 8 years mainly, if the child is not sick or doesn't have any chronic disease like diabetes, heart issues, or even asthma. So for those type of children, actually the doctor sometimes have to give a consent that the child can receive it or not. If not, they don't give it. But if the child is healthy, they should give it. and if it's available at the time that they want to give it, yes. Preferable recommendation per the CDC is to give the nasal one. Another question that people have is it better to get the flu disease instead of the shot or the vaccine? So we say no, because the flu vaccine actually has a lot of different symptoms that it can give you. For example, it can give you a lot of more complications, particularly in children, young children, and older adults. So especially people that have asthma and heart disease or diabetes, like I said before, if you have those chronic diseases and you get the flu disease, it will send you to the hospital, and you're gonna have more complications with it. So it's not recommended that you wait until you get the flu so that way you can get the vaccine. Now, another question that people ask is, do I really need the flu vaccine every year? And the answer is yes, because the flu vaccine protects you only for 1 year. Actually, it's less than a year. That's why they recommend it once a year, because it won't last like 5 years or anything like that. So it's for your body to get the antibodies, it takes like 2 weeks, and then for you to be covered, it's like 10 months really. So that's why they recommend you to take it once a year. Now for reactions, we have some people that do get side effects from the flu shot, and mainly mild side effects, which is like soreness of the throat, redness or swelling also at the injection site. Some people actually get fainted. They feel like they're gonna faint, headaches, fever, and nausea. The nasal spray can produce runny nose, wheezing, headache, vomiting, muscle aches, and fever. And serious side effects could be, like anaphylactic shock, which is you cannot breathe at all, swelling of your eyes or lips, and hives, and you kind of like your blood pressure drops. So those are severe side effects after the nasal spray or the shot. Okay.
Okay, I'll be talking about prevention. The best way for prevention is to get vaccinated. Everyone 6 months of age or older is required to get the flu vaccine each year. Also, we have like everyday precautions like washing your hands, using hand sanitizer, avoid rubbing the eyes and the nose, because this way the disease spreads easily. Also, wearing proper protective wear, PPE, personal protective equipment, like your mask when you're in contact with sick people, and gloves. And another prevention is to take antiviral preventative drugs, and the most popular one we have is Tamiflu. So basically, it's just hand washing. That's very important. Washing your hands.
All right. Last but not least, we're going to cover at-risk groups, the at-risk population. Of course, number one, starting with children. Children younger than 6 months of age, because they do not have a developed immune system to fight the infection, which is why we encourage mothers, please breastfeed your children. Please pass those antibodies to developing children. The next one will be pregnant women, being that we do want to prevent the flu spread to pregnant women to protect mother and baby, because high fevers, of course, may cause birth defects. And then lastly, an older population, age 65 years and up, meaning that they may have other health complications that may complicate the flu virus and lead to something that's such as pneumonia. So of course, pneumonia, a dangerous incident occurring in older people, so we do want to prevent that. And of course, in all age groups, we want to prevent the flu virus from infecting those who have chronic illnesses, and also weaken the immune system as well. All right. I want to answer the question that addresses if there anyone who cannot get the vaccine, and of course, those would be people with severe allergies to eggs. Those who are, like I said earlier, have a chronic illness already or weakened immune systems, and also those who have a history of the Guillain-Barré syndrome. Okay, and we also gave resources in your pamphlets for those who are interested in getting the flu vaccine and may.
Can an HIV patient get the flu vaccine?
Yes, yes, you can. Yeah, it just needs to make sure that you let the doctor know, but for the most part, yes, they can.
All right. Yeah, I lost my track of that. Yep, but that's what I was going to reference to. Go from this local clinic to get a free flu vaccine or things of that nature. And that's pretty much the end of our presentation. We didn't want to take too much of your time. So you guys have any additional questions?
Any questions, like, about the spread? I'm just gonna go back a little bit about the spread. The spread is between actually person to person, because when you cough, it's more like a contact. There's large particles that stay in the air, but they don't, it has to be like a foot away or something like that from the person. But that doesn't mean that because I cough here and she's there that she's gonna get it. But let's say that I cough and I'm a little bit far away, there's still a little bit of minute particles, I can stay a little longer floaty, and then she passes by and then she contacts it. Or if I cough in my hand and I touch a surface area, I can put the virus right there. Here comes my other friend, whatever touches the same, and then it gets the infection. And also the CDC recommends the N95 mask, because they say that's the only one really that protects you from getting the droplets. So that's another recommendation from the CDC.
And then of course, I read, when I was reading about it more, when it said the virus actually jumped from animals to humans. That's
Yes.
another way that it's passed. It actually jumps. I'm like, wow, a virus that jumps. Yes, it does jump. And being that's why it's more important that we do get the flu vaccine every year, because the virus itself mutates. Being that it's jumped from human to human or human to animals, it's so important that different strains that we do get that vaccine to prevent the infection of different strains.
And at this time, per the CDC also, we don't have a pandemic in the United States. We don't have that currently. Normally the last vaccinations or the last vaccines that came out the last year, they only cover like 3 viruses. So, but actually, there's more viruses than that out there. That's why it wasn't so effective. But even though the vaccine is not effective to all the viruses, definitely it's good to take, because it will protect you. And if you actually get the flu after vaccination, then you're not gonna have like severe symptoms. You might have mild symptoms. So it's definitely recommended from 6 months and up to take it. Any questions?
No, sorry, we have to go to lunch. We have
Okay. Thank you.
Thank you.
Bye.